Today we want to scratch under the surface of the impact of COVID-19 on the social care sector. Has it changed the way the sector operates? How is it perceived by the nation and stakeholders? Can we use the crisis to accelerate change for the better? Valorum Care Group CEO Robin Sidebottom joins me again to answer these questions and some other questions as well. Robin, let's get straight into the main question. How has COVID-19 changed the way the sector operates?
It's a really interesting question. How has it changed? I mean, there are life within a lot of our care services carries on the same and has carried on the same. I think what it has done within a lot of our services is, I guess it's made them a little bit more clinical, made them people feel a little bit more less like it's their own home, and that they've almost got sort of nurses and doctors there with masks and gowns and different things on. So I think it's very much changed the way that we are perceived and how we do things at ground level with the people we provide care and support for. I'd like to think that probably on a more general basis, professionalism of the care and what we do, that hasn't changed and that still carries on the same. And I think the impact really has been on the people that we provide the care and support for, who are obviously in very different circumstances, difficult circumstances. They're not, in most cases, able to see their family or their friends and see visitors. So I think, if anything, it's probably changed the way it's changed the life and the way of the people we support. And I think the way that we provide care and what we do, I don't think that's really changed, other than the obvious masks and the way that we have to wear a lot more PPE. I think it's just isolated an awful lot of people. And if anything, we have seen people's behaviours change because they are more isolated. They don't go out into the fresh air as much as they did. And in many cases, they don't have a loved one and family there to be able to see them other than maybe through a window. That's quite challenging. And I guess one of my biggest fears when we think about the people we support is that as we get towards the winter time, then visiting becomes harder, because where we've been able to have people in the garden and visiting the garden, that becomes a lot harder when the weather changes. So I think, has it changed the way we operate? I don't think it has changed the way we operate, but I think it has changed the lives of the people that we provide care and support for. And I think it's also affected their mental health and the way that they would normally live their lives. And I think that's changed beyond all recognition over the last 6 months and shows no signs of changing anytime soon.
Yeah. During the crisis, it seems to me that we've seen a bit of an awakening in terms of how the public sees social care workers. Early doors, we heard stories about care workers being treated a little bit like second-class citizens when it came to getting, for example, priority in healthcare, work at shopping slots at supermarkets. NHS staff were kind of perceived as the heroes, but recognition for the social care workers was not the same. Where do you think we are now in that balance?
I don't think anything's changed, if I'm being completely honest. I think very early on in the pandemic, there was an awful lot of big things around the NHS and NHS heroes, and absolutely right, because those people are on the front line and putting their lives at risk. There's been talk of care homes and being the forgotten heroes. I think that's absolutely true, and I think it took a number of weeks and a number of sort of campaigns for people to sort of wake up to the fact that care home staff are also putting themselves at the front line, and when you have people, as we do as a provider, going into hospital, having treatment, and then potentially coming out with COVID, that is quite challenging. And I think somebody once said that it's almost like putting a fox in a chicken coop. And I don't think I could describe it any differently from that. We were not particularly exposed to that too much. We had incidents of that. But ultimately, I think there was a feeling that social care was forgotten. And I guess because I've been in this sector for 30 years, nothing really surprises me. And I have to say, I was probably, when the pandemic started, I was hopeful that if only one good thing came out of this, it would be that social care was recognised alongside healthcare. And the reality for me, unless you are in the sector, then a lot of people don't really understand the difference between social care and healthcare. Care is care is care. Whether you need hospital treatment, whether you need wounds dressing, whether you need somebody helping with your tea or helping put to bed, they're all forms of care. And the fact that we're in a sort of a two-tier society, and it frankly is bonkers in this day and age. So I see shoots of things happening. I see little green shoots of let's treat everybody the same and let's bring this together as care. But I still unfortunately feel that we've gone through this pandemic. There has been a whole, yes, the social care is really, really important. I sort of feel that that momentum's gone a little bit, and the promises that were made and the views that were out there hasn't really changed. And I guess I'm seeing this at ground level, and I'm seeing this with local authorities who some seem to think that COVID finishes on the 5th of September. That's when the funding for PPE stops. Some of them are not prepared to give increases from April of this year. They're not prepared to give increases to us as an organisation to pass on to our care workers. And I think that for me just says, in reality, not a great deal has changed. And it disappoints me, if I'm being completely honest. I'm not surprised, but I am very, very disappointed that really, for me, we're no further on now than we were when this pandemic started 6 months ago, virtually.
So you don't think those kind of green shoots that you kind of mentioned in terms of small changes in perception will be enough to create public pressure to sort the social care sector out once and for all?
I don't think it will, quite honestly. I really don't think it will. And generally, I'm optimistic sort of a person, but I just think we've got such a dispersed way of delivering care. We've got such a dispersed way of doing things in this country. And when you put layers in between different things, it weakens and it waters things down. And because you've got the NHS, which is a massively funded organisation, and it needs to be funded and it needs to be set up in a professional way, the money goes from the government to the NHS. The NHS spend the money. For social care, the money goes from the government to the local authorities. The local authorities then pass it on to the care providers. And there is still, for me, a very clear sense that some local authorities don't really want the private sector to be involved. They don't really want to fund that. And for me, it's actions that speak more than anything else. And when you look at places like Wales, where they've given, I think, £50 or £100 to each of the social care workers that worked through the pandemic, it's small, but it's a nice appreciation. We have some areas of the country where we haven't had an increase on our fees for 2 years, and the minimum wage has gone up by 10% in that time. And that, for me, it completely devalues the workforce. It completely devalues it. And because we've got a patchwork quilt where we've got some really good local authorities who would say, we need to invest and we need to fund and we need to get this right, and they will pay good money, which means we can pay good money to care workers and recognise the work they do, that's brilliant. But you can have an area next to it where they will pay significantly less and they will not give an increase. And unless we change that, for want of a better word, postcode lottery, then we're never going to be able to have a professional social care workforce across the UK. It is just not possible. In some areas, you get paid £13 an hour for care. In other areas, you get paid £25 an hour for care. It's just not possible in some areas to provide a sustainable service. And the impact of that is that you end up paying people poorly, and you end up with people leaving and going off and going into retail and different sectors. And it can't be right that in a forward progressive thinking country that we are paying our social care workers minimum wage. It can't be right that we put all the responsibility onto them for the cost of a minimum wage. It's just not acceptable. We don't pay minimum wage in the NHS. We don't pay minimum wage in many other sectors that are related to health. And I can't understand how we believe that is right for the social care sector as well, because the responsibilities are exactly the same.
Yeah, and from what you're saying, it's pretty clear, isn't it, that the COVID crisis has exposed some pretty major fault lines in the current system. It's so multi-layered, as you say, with local authorities, government agencies, public and private sectors, providers. Do you think there's been a kind of disconnect within the system in terms of urgent actions, for example, PPE or funding that you've already alluded to? Do you feel that's kind of shown the fractures up in the system even more?
Absolutely, 100%. The funding, I think it was clear from the government that they were giving an amount of money to local authorities to provide for COVID, and that was COVID generally. And so there was a significant amount given to local authorities. That was given to local authorities to then use for COVID, for their own services and for the private sector as well. The reality is, we were able to access that funding, predominantly for the excessive cost of PPE. I think probably the last I was aware of, we had about 20 different ways of claiming that money back. We work with about 130 different local authorities and CCGs across the country. And we got to a simply ridiculous place where we had to recruit somebody just to be able to do the piece of work to claim the money back from the local authorities for the PPE. And it was just absolutely crazy. We went from some local authorities saying, send us the invoice. We also had some local authorities said, we'll pay you 5% on top of your invoice. Some said, we'll pay you 10%. I think one said 15%. One gave a lump sum. But then the ways that you had to claim that was just very, very onerous. And certainly to date, we are spending roughly about £100,000 a month extra on top of our normal costs for PPE. And I suspect we've probably not even claimed 30% of that back because it's just so difficult to do it and it doesn't get paid straight away. Because PPE is in short supply, because demand is high, when we order PPE, we have to pay for it up front because it is on a quick turnaround from the suppliers into our suppliers and then to us. So a ridiculous amount of, administration have gone into it. And I sort of struggle with why there wouldn't be a metric, very simple metric that said, if you are in a private care home, we estimate that PPE is costing X pounds, and therefore we'll give you X pounds per week, every week, directly from the government for your PPE and for your costs. I find it really, really bizarre that we had to employ someone to be involved in that process. I find it really bizarre that it's just very, very complicated and complex. And for me, it just takes away from the fact that this is a crisis. The government have put the money in, and I think the government supported the sector well from a funding perspective. But the way that it went from the government to the local authorities and came to us was ridiculous. And I'll give you just one more scenario just on that one. We have a number of care homes where, because they are specialist, we have people referred from different areas. So, for example, we may have a care home in Leeds that has people funded from 5 different local authorities across the country. The way that the funding was driven through that was the money went to the local authorities to pay us for the people that we looked after on their behalf. So I could have a ridiculous scenario in, for example, a care home in Leeds, where I have to work out how much the PPE cost for that home, and then I have to break it down by how many people in that home, and then I have to invoice or claim the money from 5 different local authorities. And some of the local authorities we work with, they might only fund one person. And it just is an absolutely bonkers way of doing things. And I just can't understand why you would overcomplicate something like that in a pandemic situation, and you would put providers at risk financially, which we have seen in the news and seen it out there, and put providers at risk financially because they cannot afford to get the PPE in and they can't get the money back from the government quick enough to be able to cover the costs of it. And that, for me, is a shining example of the patchwork quilt we have in this country and how social care is classed as a second-class provider of care. It just isn't seen as a mainstream important area of care. And that concerns me because if social care is funded in the right way and done properly, it's a preventative tool and it prevents people from going to hospital. It supports people. And in my world, prevention is far better than cure. And the more money you pour into the NHS, you'll be able to provide more hospital care. But ultimately, if you pour money into the social care sector, you will be able to stop people from going into the NHS. And therefore, you will be able to use funding in a better, more wiser way than it has been done before. And for me, COVID has exposed a number of those failings that we see across the country. And I guess I must emphasise it's not everywhere, but there are a large number of local authorities who hide behind red tape and they're very difficult to work with when it comes to funding. So ultimately, I think we've seen that through the COVID scenario, and I'd like to think that won't happen again. But unfortunately, I'm too long in the tooth to know that it likely will.
Yeah, and I guess that is a genuine concern, isn't it? That COVID, in some form or the other, is with us now for the foreseeable future. How are you preparing for what lies ahead, particularly obviously with winter coming up?
Our preparations and what we were doing for the lockdown and what we did in March, it hasn't changed in reality. We are still doing the same things. But the visiting is still very much distant. We've still got all the PPE. We're getting supplies of PPE. So the reality is we haven't really changed what we were doing. But I think as we go through the next time period and we go into the winter, I think it's going to expose and will expose a number of new challenges for us. So I think I mentioned earlier in regards to the funding that we get from local authorities for COVID, for PPE. We're still using the same amount of PPE now as we were back in March, which, clearly nothing has changed. But we have already had at least, I think, 4 or 5 letters from local authorities saying that the funding for PPE will finish early in September, 5th of September, I think some of them said. So I am seriously concerned around how the funding for PPE continues beyond September in lots of areas. And I think we are going to have a very desperate situation when we come in to buy PPE and not having the funding for it. I think that's going to be that worries me in September, October. I'm very, very concerned about that. I'm very concerned about the complacency and team morale. So I think with the local lockdowns that we have at the moment, that's very, very hard to manage. And it's hard to manage because not only do we have the normal lockdowns and the safety things in place that we have at the moment, but potentially we have staff that come from one area to another area. And we have people that do work on some of our services, whether it's gardening, whether it's cleaning the windows, whether it's doing repairs and maintenance. Managing those sort of things is quite difficult. And we have a lot of people that go into services that may come from a lockdown area that it's not appropriate. So it becomes harder to manage as you have got more of a patchwork quilt of lockdowns in different areas. It becomes hard to manage because of people's complacency, and people sometimes think COVID's over, or it's not as bad as it was, or things are okay now. So keeping that momentum going is very, very difficult. I think keeping morale going is very difficult. We have an awful lot of tired people out there that have worked a lot of hours, some by choice, some because they want to work the hours so we're not short-staffed, so we don't have to bring agency staff in. So I think we've got a lot of tired people. We've got a lot of people who have maybe not taken as many holidays as they should take. I think we've got people who probably were expecting to go on holiday and couldn't go on holiday. So all of these things mixing together, and I think it creates a very difficult challenge as we head into the winter. And the fact that we've not really had a summer, we're going into the winter and facing those challenges when it's cold, it's wet, it's dark, it's not a great time of the year, is going to be difficult. And I would be lying if I said that we are prepared for all of those things. We're prepared for COVID to continue, and we're prepared for the PPE, and we're prepared for carrying on doing what we're doing at the moment. But being prepared to try and keep staff morale up and try and keep people safe and not working too many hours and keeping positive is a very difficult challenge. And very early on, we did quite a few things for our staff team. We managed to get some biscuits donated from Foxes, and we got those out to the services, and we created some badges and cards to say thank you to people. And for us, the challenge is what else can we do? How else can we support the staff? How can we keep morale up? And we do scratch our heads on that quite frequently and say, what can we do next? Because in reality, the world in the care homes hasn't changed today and won't change going forward from what it was in March or April. I am seriously concerned for people's welfare, for people's mental health, and for people potentially, becoming burnt out. And that's not where any employer wants to be. And we've got to work really, really hard to make sure that that side of things is supported and we move forward. The cost of the PPE, it's a worry for me, but it's money and we will deal with it. But people and morale and keeping everybody motivated is a bigger challenge in an ongoing pandemic that shows no signs of disappearing anytime soon, and potentially could get worse in some areas before it gets better. And that's a big worry for me, massive worry.
Yeah, so some pretty significant challenges ahead then for kind of your business and your organisation. But also looking ahead, what changes do you think are urgently needed in the social care sector as a whole?
I think ultimately, we have to seriously take a look at social care and healthcare. And I think there has been some muted views of potentially the NHS taking over social care. And obviously a lot of the devil is in the detail. But for me, having some sort of unified approach to care has got to be the future. It doesn't make any sense that we have two completely separate parts of care, which one is seen as more professional or better than the other one. It doesn't make sense that we've got people that are looking at the sector and go, I'd rather be in NHS or healthcare because that's more professional, that's better, or you get paid more there. This should be one approach. When people need care, they need care. And we need to recognise that. I think for anybody who has got a family member who needs care, who is looking at getting some care in the future, it's a minefield. As a care professional, I certainly know when I was looking to provide care for my elderly gran 10, 12 years ago, and I was in the sector, actually trying to arrange home care, trying to get it sorted, trying to sort of put everything together, it was horrendous, and at the time I was the ops director of one of the biggest care at home providers in the UK, and just trying to sort something out for my own family member was a nightmare. And I think we've got to make things easier for people. We've got to make it so that everything is unified, and ultimately, the government have talked about the green paper, and they've talked about doing different things. And do I believe they will do something? I don't think they have a choice. I think they have to do something. I think the wealth of public opinion is there. I think the problem the government have got is always going to be a financial one, because the cost of social care increases every year and the funding doesn't increase at the same level. So you have probably not even 10 years of underfunding. You've probably got 15 or 20 years of underfunding. And I can see where the government will go in the future, with potentially people paying either more national insurance or paying a pension or paying money for you to use for care when you need it. The biggest question I think the government has got, how do you bridge the gap from what is needed now to eventually get into a society in 20, 30 years' time where people have saved money or put money aside for their care? And I think that's a major, major question that I don't think the government can answer. I don't think they will struggle, and especially with COVID and potential austerity and the challenges that are going to face society in the coming months and years to come. How do you fund an already underfunded sector? How do you get that right? And I think the idea of getting it together with NHS, I think, is a good move, because potentially it could save money. It will save money in administration. It will save money in overlaps. It will save money in people in the background trying to work out, how much to charge somebody for healthcare and how much to charge somebody else for social care. So if it's done right, it could work. And I can't see what else could be on the table for the government to do that potentially would bring it together. So care is care, and ultimately potentially look at some savings along the way, but ultimately give people who need care, or the people who are arranging care for people, a slightly easier ride in regards to what they understand about care and how to arrange care and how to do it properly. As I said, I've been in the sector for 30 years. I'd like to think things have changed significantly in that 30 years, and they probably have. There's a lot of things that haven't changed. And I guess I have a lot of scepticism, because we talk about it a lot, but we don't always get it sorted. And it's a big problem that needs to be sorted, and it needs to be sorted soon. But we can't continue in the same way if we are serious about providing good quality care for everybody in society, and that everyone's got an equal option to get care, and it's not a postcode lottery. Things need to change, and need to change quite quickly in that respect.
Colin, as usual, very informative insight. We'll be talking again in the near future about the things that matter in social care. Thanks again for your time.